If you can't hear me, I apologize. I chose not to do slides before I didn't have a voice. So anyway, I'm happy to talk to you after if you have any questions or anything. I'd like to start out by thanking my committee for their incredible support through all of the challenges and the barriers I've faced in this research. And I just noticed Jan sitting back there. Jan's one of my supervisors. Dr. Bill Fisher is another one of my supervisors. And I have Dr. Trina Orchard and Dr. Lillian Magalese on my committee as well. So I think without their support and all the battles I've gone through, I probably wouldn't be here where I am, or at least semi-sane where I am right now. I do have a poster out there, so I won't give you too much information about my research. It's also in the abstract. My research is with HIV-positive youth, and I look at their sexual health and disclosure concerns. So my biggest challenge throughout this research, contrary to Laurie's experience, has been with the ethics board. And anybody who knows me knows a lot about what I've gone through and what I've had to overcome just to try and do this research. So I wanted to share some of that information with you, and hopefully it helps you not to get discouraged and just to keep going and battle through. I spent about a year off and on, and I'm still on battling with ethics over many issues. So the first issue I had with ethics was because my population is 14 to 29, they wanted parental consent for anybody under 18. And as I told you, I'm talking about sexual health and disclosure issues. These kids aren't going to talk to me if they have to tell their parents they're talking to me about sex. So that was actually one of my smaller battles. I brought ethics lots of information on studies that were done in Toronto. I gave them probably over 2 pages of information on how much more harmful it would be if I had to get parental consent. And after probably about 4 months, I won the battle. They took parental consent, they waived parental consent, so the youth were able to consent for themselves. The next battle I had to overcome, because I do qualitative research and I do community-based research right along with that. For this research, I hired a youth advisory committee. This was my original intention, and when I went to ethics, I had to explain why I wanted to do that. And anybody else who does community-based research knows that most ethics boards don't understand community-based research. So I faced a lot of challenges and a lot of barriers to try and explain why I wanted the Youth Advisory Committee. And after about 3 months, I finally got them to say yes. So I spent about 8 months working with the Youth Advisory Committee on things like my questions. I wanted it to be youth-friendly. I didn't want to alienate people. You know, I wanted it to make sense to people. You know, I don't know what it's like to live with HIV. Yeah, I was a youth once, but that was a long time ago. But I needed the research to make sense. I needed it to be questions that were important to these kids. So when we finally went through the 8 months, got to the point of we were going to start recruiting, I wanted to keep the Youth Advisory Committee on. I had just spent 8 months building a trusting relationship with a very stigmatized, vulnerable population. And, you know, I had a great relationship with this group. So I asked ethics if I could keep them on. And the answer I got from ethics was, their role's done. If you want to have another youth advisory committee, you have to hire a new one. So I said, I just spent 8 months building a relationship and you want me to start over. So I'm actually still in that battle right now. I've brought in lots of evidence to them. The other battle I went through was the youth advisory committee participants also wanted to be interviewed. They wanted to be able to provide information because being in research was very important to them. So I went to ethics, asked them about this, and their technical term was the waters are getting muddy. And I think that you'd be stepping over a boundary if the Youth Advisory Committee was going to be interviewed. From what my one advisor, Bill Fisher, says, their concerns are more methodological than ethical. They wanted to know how I was going to separate the data and analyze the data if I had the Youth Advisory Committee members responding to the questions, and, you know, because they would have more insider information, they said. I mean, I gave them lots of information on how I'm not the very first person to do this and I won't be the last. And I said, you know, it's going to be done like any other person would analyze data. You know, if you have people that have a little bit more information, yeah, you separate that data, you see what they found out, and then you put all that data together and see if all the themes are the same. So as of yet, I haven't heard back. It's been a very, very ongoing battle of trying to get them to actually respond. And I did, you know, I've had such support with this research, which is what leads me into the rewards of all this was actually worth it. Because, you know, the first thing I did was I built this incredible relationship with a group of youth who, as I said, live with such a highly stigmatized disease. It's very hard for them to trust somebody. You know, somebody that's not going to fly in and do the helicopter research and fly back out. You know, they've actually grown to know me and know that it's not just about me getting a PhD. Like, I've gotten involved in the community-based organizations. I've gotten involved in creating workshops. So it took a long time, but I mean, it was so rewarding. If I hadn't have done this, you know, a lot of things in my research changed. Like I said, the questions, even the title of my dissertation changed just by meeting and talking with this Youth Advisory Committee. And as I said, it wasn't just the Youth Advisory Committee. I made huge connections and supportive relationships with community-based organizations and aid service organizations. And when I was having all these ethical issues, I had 15 different people saying, you know what, this person can help you, or, you know, this person can help you. So I mean, just even having that connection, you know, and having my committee standing by me got me through all of this. And I think if I hadn't have taken all these extra steps, I wouldn't, you know, I wouldn't be here, and my research wouldn't be the way it is now, and I wouldn't have, you know, I think it's made me a better researcher, and it's made my research better. So, yeah, I guess that's about it. Thanks.